I really want to get a dialogue going about the shocking, and I mean shocking, things that have developed on healthcare just in the last 4 or 5 days. And let me just mention those 3 or 4 items briefly, and then maybe we can get a dialogue going and talk back and forth about them. First, we had the CBO score of the Baucus bill. Wow. Our colleagues on the other side of the aisle, Democrats across in the Senate, were high-fiving each other. Oh, my gosh, they had a score of only $829 billion. I wonder if the gentleman realizes that the CBO scored that bill counting 10 years of revenue from the taxes, but only 7 years of expenditures. Under the Baucus bill, taxes start in 2010. Expenditures for the program cost don't begin until 2013. So when CBO scored it for 10 years, beginning in 2010, ending in 2020. They counted 10 years of revenues, 7 years of outlay. I went home to my wife and said, even the Shadegg family budget would look good. Even the Shadegg family budget would look good if we could count 10 years of my salary and her salary or our income and only 7 years of our family outlays. That's scandal number 1. They get better. Scandal number 2, we discovered that Harry Reid, Majority Leader of the United States Senate, found out that under this bill, because the cost of Medicaid is going to be increased dramatically, the size of the Medicaid program is going to be increased dramatically, that the burden paid by the individual states would go up quite significantly, including on Nevada. As it turns out, Harry Reid's up for re-election this year, and he says, whoa, 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 whoa. As your Senate leader, I can't be hurting the state of Nevada. So he got an exemption. Interestingly, not an exemption for all 50 states, no exemption, for example, for Iowa, where the gentleman's from, no exemption for the state of Arizona, where I'm from. He got an exemption for Nevada and 3 other states, Oregon, Rhode Island, and Michigan, under which the federal government will pay the state's share of Medicaid if this bill passes for the next 5 years. Just a little perk for a powerful United States senator like Harry Reid. You know, it occurs to me, and I'll go through these other scandals very quickly, but what we're really getting here is we're not just getting single-payer care, we're getting full-on Russian gulag, Soviet-style gulag healthcare. Because under these plans, it won't matter so much that you live in America. It will matter whether you live in the state that's represented by a powerful senator or perhaps a powerful congressman, because we just learned Harry Reid has just protected the people of Nevada and 3 other states from having to pay their share of the Medicaid expenses. But wait, as they say in the advertising world, there is more. Because, as you know, the funding mechanism of the Baucus bill says we're going to impose a surcharge on very expensive gold-plated health care plans. Got to tax those expensive health care plans. Well, Chuck Schumer, little Chucky Schumer of New York, United States Senator, said, wait, that surcharge might apply to my constituents in New York. I can't have that. So Senator Schumer, in the give and take of politics in America, if we're going to have political health care, by gosh, we're going to have really political health care, he said, no. We'll allow that surcharge, which is a 40% tax on policies that cost over $21,000, we'll allow that to be the law in Kentucky or in Arizona or in Iowa, where the gentleman's from, but no, not in New York. In New York, we won't let the surcharge kick in until the policy costs $24,000. And in Massachusetts, it won't kick in until the policy costs $25,000. So, if you're lucky enough to live in a state where you have a powerful senator like Chuck Schumer, you can get it so that your luxury tax won't kick in until your policy costs $24,000 or $25,000, unlike the poor sap who lives in Arizona or Iowa or Kentucky, where the luxury tax kicks in at $21,000. Ladies and gentlemen of America, you want political health care? You want politicians in charge of health care? by gosh, you're going to get it, because that is politics, American style. It is as corrupt as it can get, where politicians like Harry Reid, powerful, can protect their state, Chuck Schumer, powerful, can protect their constituents, but as they say in the marketing business, but wait, there is more, because our famous United States Senator from New Jersey, Senator Bob Menendez, that wasn't good enough for him. Bob Menendez represents a state where there's a lot of health care drug companies that manufacture pharmaceuticals. Senator Menendez, they wanted his vote. He negotiated a deal. He got a $1 billion tax credit into this bill, into the Baucus bill, for investments in drug research and development. By all means, let's protect New Jersey, because Bob Menendez's vote is needed. But wait, there is more. Because in the political world of political health care, if we're going to politicize health care, if we're going to give the politicians control of our health care from border to border, coast to shining coast, or sea to shining sea, by gosh, that isn't enough. So Debbie Stabenow of Michigan and John Kerry of Massachusetts said, you know, this health care could be really expensive, and we have lots of union workers in our states, in Michigan and in Massachusetts. Debbie Stabenow, John Kerry, they got just a small little piece in the bill. You know, we're going to play a little politics with health care. Why not play a little politics? They make Bob Menendez look like a piker. They got $5 billion, count them, $5 billion into the bill to defray the cost of medical care for union workers. Now, if you happen to be a right-to-work state like Arizona, where we don't have many union workers, well, that's just too bad. You don't get the benefit of that $5 billion. But if you're a union worker, Debbie Stabenow and John Kerry are making sure that those poor saps in Iowa that aren't union members, and those poor saps in Arizona who aren't union members, get to chip in an extra $5 billion for the union members in Michigan and Massachusetts. Not to be outdone, Mark Udall of Colorado. He comes in and says, well, this may be round one where we negotiate amongst the members of the committee that the bill's going through right now, but trust me, if Harry Reid has gotten a provision in there saying that Nevada doesn't have to pay the state share of Medicaid, by God, I, Mark Udall, am going to fight for the same provision for my state of Colorado. So there you have it, ladies and gentlemen. Don't believe me. All of what I've just recited for you comes from the Wall Street Journal, an article called States of Personal Privilege by Kimberly Strassel. It appeared in last Friday's Wall Street Journal. You can Google it. You can pick up the phone and call Kim Strassel. You can ask her about Soviet-style gulag health care in America, where powerful politicians protect their constituents. But if we're going to have socialized medicine, if we're going to have government run, you said this is the Hillary Clinton was a overnight takeover of health care by the government. The current version, Obamacare, is a gradual takeover. Trust me, the minute you take power away from the people and give it to Washington politicians, you get real sweet deals. Powerful Harry Reid protects Nevada. Powerful Chuck Schumer protects New York. Powerful Bob Menendez protects New Jersey. Powerful Debbie Stabenow and John Kerry protect Michigan and Massachusetts. And at least Mark Udall, kind of a pup in all of this, a little bit young, not seasoned and powerful yet, he's going to try to protect the people of Colorado. Political health care, here we come. What you pay for health care in America, once this bill is law, won't depend so much on the bill as on whether or not you've got a powerful United States senator or a poor sap United States senator who can't pull the levers of power and get done what you want.